So now that we've assessed our risks and we know our residual scores, what do we do next? Well, we could decide that we want to manage or treat our risks. Now, some managers call this risk treatment. One option is that we can accept the remaining residual risk. We might look at it and decide that it's within our risk appetite. And we might decide that the residual risk is too high and that we can't lower it any further, so we should avoid the underlying activity altogether. In other words, we're essentially saying that the potential benefits of the activity aren't worth the residual risk that we can't practically control further. Next, we could look at ways to transfer the risk to a third party. Buying insurance and signing legal agreements to share or shift risk are the classic examples in this area. And finally, we may decide that there's further pre-event, post-event mitigation steps that we should take to lower our residual risk even further. And as I shared in the earlier slides, this would lead to action plans that get assigned and followed up on to make sure that we follow through and actually do our mitigation plans. Now, I guess in a few final comments, I'd say that these are not definitive terms. You might see different labels or categories, but these are the most common terms that we see. And also in practice, there's usually multiple mitigation or treatment strategies rather going on at one time. There may be some mitigations in place, you've got some planned. Some of your mitigations might actually technically be transfer agreements. And ultimately, after mitigating and transferring, you may just decide to accept the residual risk that's left. So I would caution you about not getting too hung up on nomenclature and not trying to force yourself to pick one treatment method or another. It's usually most important really to consider your residual risk relative to your risk appetite, and then to decide what you need to do if those two are out of alignment.